good morning, and I hope you're well. So today we're going to have a little look at the shoulder cuff rotator muscles and how we can release some pain and tension from around this area. So with the other video, with the neck and shoulder and the self-massage, I would encourage you to have a look at that video, because you could start off, if you have shoulder problems, by loosening up the neck and the shoulders and also doing some assisted stretches to loosen that up. But we're primarily looking at the shoulder itself. It's very complex. There's a lot of different muscles that attach and originate that go into the area to stabilise but also allow that full range of motion. Okay, so if you look at the shoulder itself, it enables us to take the arm all the way back, forward, rotate out. So we get a maximum range within the shoulders. Now when the muscles become tight and the tendons become tight, then we get a restriction. Now this can be due to an injury. You might have fallen, you might have hurt yourself, or you might have been doing a little bit more exercise and just pushed it that little bit too far. So what I would always encourage you to do first is have a look at your own range of movement. So for example, have a look and see where the pinch points are. So for example, if I take my arm up and I push that back, have I got a good range of movement going back? Am I getting any pins and needles, any tingling sensations going up into the fingers? And then I'm going to drop that down. If I take my arm further back, have I got any restrictions? Is there a restriction at the back where the shoulder cuff rotator muscles are? And then bring that forward. If I take it into what we call a little bit of a distraction, where I'm pressing down onto the shoulder, releasing the arm, and just allowing it to hang and rotate. Am I hearing any clicking, crunching, or anything that feels particularly uncomfortable? And then we look at the movement from taking the arm out in front. If I take it out there and try to hold it, do I get any burning, any tingling, or any aching around the front and around the cross of the deltoid area here? And then we take it back. Likewise, we're going to take it back. Am I finding any restrictions? And then you're going to just check your range of movement by taking it out. And then we're going to take the arm up and see how far we can bring that. It might be that actually when we get to here, there's a little bit of a restriction, and then we're going to bring the arm down. Now always compare it against both sides, because remember, if you're using one side a lot, you might have a little bit more mobility. So when you ascertain, okay, so I know I have a restriction at a certain height, and then if I take the arm back, so when we're actually doing an evaluation to look at your range of movement in that shoulder cuff rotator area and also the associating muscles, then we'll use that as a guide going forward. But it's good for you to have a look and think, okay, so that's what I can do. I've got a good range of movement, or actually it really does hurt. And of course, the other one, just taking it out to the side. If you get to a point where you start to feel it pulling down here, again, that's a good indication when we do a treatment where the impingement is or where the muscles are tight. So you also bring in the head as well to have a look. Is there any tension loading across the shoulder, going into that muscle, and then release. So you're looking at every different way that you can move that arm to find out where our pinch points are. Now, as I've said also, you'll find that where the pain isn't always where it starts and originates from, but it gives us something to work with, and it gives you something going forward to look at, okay, that's where I've got the problem. So I need to try to increase the range of movement of the arm going back. But is there something catching right into where we get the insertions of the muscle that are causing the problem? So as with everything, we end up by looking at doing a few stretches. So we would encourage the head exercises, which I've already covered, and we would then go on to trying to increase the rotation of the shoulder. And one of the first things that's really good is to get a light weight into the hand, drop the arm down, and just start to release any tension. When you place a light weight, the weight of it causes the muscle to release from the stretching as we take the arm back. And you'll be able to feel if there is any cracking, crunching, creaking. Now, if you don't get any pain, sometimes people go, oh my gosh, I've got really, it really sounds loud. If you're not getting any pain, then that just might be a little bit of general wear and tear, which by increasing the mobility, increasing the blood flow to the area, you will find that that will improve over time. And also by strengthening the muscles, that can help with wear and tear getting worse. So you might not be able to completely go back and undo any damage, but you can certainly make it better. So we've done the rotation. We also want to bring in a little bit of just gentle movement, taking it out, shoulder circles, back, and sometimes by doing a little set of 2 and 2 to start off with. Okay, so this is all about mobilising, and then taking the arm across and taking the arm out, nice and slow. What you don't want to do is to go into any heavy weight load bearing or putting any additional pressure on there. This is all about opening up the joint. Okay, and then another good one which we love is the don't shoot, where you take both arms up. Now you might find that at this moment in time, if you've got a restriction on the arm going back, that's quite difficult. So stabilise the shoulder, placing the hand above the shoulder, and just take it to where you feel comfortable. So again, you're oiling that joint. And then relax. So by increasing the blood flow, releasing the tension, that can help going forward. Also, trying to stretch out the pectoralis muscle. So you might find that actually the impingement comes more from this area when you're feeling it and when you're mobilising and moving that arm. So again, pop a little bit of tension in there, and that will help you to move it a little bit freer, stabilising, keeping the joint secure while you're doing the exercise. And the key is for shoulder when you're doing any self-work is to bring in the movement. So we're looking behind, right into where the muscles insert. Then you can hold the trigger point and the pressure point there as you move the arm away and release. So again, using the trigger point therapy by applying it to different points and taking that mobilisation out, you will find that you will get an increase of movement. So I hope you found that helpful, and look forward to seeing you soon.